You walk into a room and forget why you came in. Then notice your feet are tingling again, and your first thought is, am I starting to lose my mind? In adults over 60, low or borderline vitamin B12 is common, and severe deficiency is less common, but often missed. One NIH summary found about 12.3% of adults over 60 were below a B12 level of 300, and about 21% had an abnormal result on at least one B12 marker. The frightening part is this: B12 deficiency can cause memory problems, confusion, poor balance, numb feet, fatigue, and mood changes. In other words, it can look like aging. It can even look like early dementia. And if the nerve damage goes on too long, it may not fully reverse. B12 is not just another vitamin on a label. Your body uses it to keep nerves healthy, make normal red blood cells, and support DNA production. When B12 drops too low, your blood may not carry oxygen as well, and your brain, spinal cord, and nerves can start sending warning signals. The first warning sign is fatigue that feels out of proportion. Not just being tired after a long day, but feeling weak, heavy, or unusually short on stamina. You may notice the stairs feel harder, grocery bags feel heavier. You sit down more often between simple chores. This can happen because B12 is needed to make healthy red blood cells, and red blood cells help deliver oxygen. The second sign is numbness or tingling, especially in the feet or hands. Many people describe it as pins and needles, burning, buzzing, or the feeling that socks are bunched up under the toes when they are not. This one is easy to dismiss as circulation, shoes, or age. But B12 deficiency is a classic cause of nerve symptoms, and it often starts in the feet. The third sign is balance trouble. Maybe you are not falling, but you are catching yourself on furniture. You look down more when you walk. You feel less steady in the shower, on steps, or crossing a parking lot. B12 deficiency can affect the spinal cord and the body's sense of position, so your feet may not communicate clearly with your brain. That is when independence starts to feel fragile. The fourth sign is the one that scares families most: memory problems, confusion, or slowed thinking. A person may repeat questions, lose track of conversations, struggle with words, or seem mentally foggy. Of course, not every memory problem is B12. But B12 deficiency is one of the reversible causes doctors should consider before someone accepts a label like dementia. This is especially important because nerve and brain symptoms can happen even when blood counts look normal. A normal hemoglobin does not always rule it out. The fifth sign is mood change. Irritability, depression, anxiety, or just feeling unlike yourself can show up when B12 is low. These symptoms are not specific, meaning they can come from many causes. But if mood changes appear together with fatigue, tingling, balance changes, or memory slips, B12 deserves a closer look. The sixth sign is pale skin, shortness of breath, or heart palpitations. These are more likely when B12 deficiency has caused anemia. You might feel winded doing things that used to be routine. You might feel your heart pounding after mild effort. That is not something to brush off. The seventh sign is a sore, smooth, or painful tongue, sometimes with mouth soreness. It sounds small, but it can be a real clue. If your tongue feels unusually tender or looks smoother than usual, especially along with fatigue or nerve symptoms, pay attention. The eighth sign is vision change. This is less common, but it is recognized. Any new vision change should be checked promptly, especially if it comes with numbness, balance trouble, or confusion. Now here is why this happens more often after 55 or 60. B12 in food is usually attached to protein. Your stomach needs enough acid to release it, and it also needs intrinsic factor, a helper protein, that escorts B12 so your small intestine can absorb it. As people age, stomach acid often declines. NIH notes that atrophic gastritis affects about 8 to 9% of adults, 65 and older, and that can reduce B12 absorption. Some people also develop pernicious anemia, where the body attacks the stomach cells involved in intrinsic factor. Then even a decent diet may not be enough. Certain medications raise the risk too. Long-term metformin use is a recognized risk factor. Long-term acid reducers, especially proton pump inhibitors, such as omeprazole, esomeprazole, and pantoprazole, can make it harder to release B12 from food. A vegan or strict vegetarian diet without fortified foods or supplements can also lead to low intake, because natural B12 is found mainly in animal foods. Crohn's disease, celiac disease, gastric bypass, partial stomach removal, and heavy alcohol use can also interfere with nutrition or absorption. Here is the turn toward action. You do not have to panic, and you do not have to wait until things get worse. But you do need to be honest about the pattern. If new tingling, balance, trouble, confusion, weakness, or memory change is happening, do not simply call it aging. Ask to be checked. Food is still the best place to start for prevention and support, as long as we are medically honest. If your B12 is low because you are not getting enough, food can help a lot. If you are over 60 and not absorbing B12 well, fortified foods or supplements may work better than food alone, because that B12 is not bound tightly to food protein. The daily B12 requirement for adults is 2.4 micrograms. A 3-ounce serving of salmon provides about 2.7 micrograms, slightly more than the adult daily requirement. That makes salmon a practical food first choice. Trout and sardines are useful choices too. Fish supplies preformed B12, the kind your body can use if absorption is working. And Harvard notes that milk and fish may be particularly useful sources. Dairy is another simple anchor. Milk, Greek yogurt, and cheese contain B12, and dairy appears to be highly bioavailable. For many people, a bowl of fortified cereal with milk, or Greek yogurt with breakfast, is easier than planning a perfect dinner every night. Eggs also provide B12, though they may not be as strong a source as fish or dairy. Still, eggs can be part of a steady pattern. If you eat meat, beef and beef liver are natural B12 sources, and clams are especially rich. But you do not need to build a whole plan around red meat. For many older adults, the easier routine is fish a couple of times a week, dairy most days if tolerated, eggs when they fit, and fortified foods to fill the gap. Fortified foods matter more after 50. B12 fortified breakfast cereal, fortified soy milk, or other fortified non-dairy milks contain added B12. This added form is not attached to animal protein, so it can be easier to absorb when stomach acid is lower. The important step is to check the label, because fortified foods vary a lot by brand. Do not assume every cereal, plant milk, or nutritional yeast has B12, unless the label says so. And do not rely on unfortified plant foods as your B12 plan. Seaweed, spirulina, tempeh, mushrooms, and unfortified nutritional yeast are not reliable B12 solutions. They may be healthy foods for other reasons, but they should not be treated as dependable B12 sources unless they are specifically fortified. Supplements can be useful, but they should support the plan, not replace common sense. For true deficiency, research and guidance often use high-dose oral B12, commonly 1,000 to 2,000 micrograms per day, and studies show high-dose oral B12 can correct deficiency in many cases. Injections may be preferred when deficiency is severe, when there are significant neurologic symptoms, when pernicious anemia is present, or when absorption is clearly a problem. Many over 50 multivitamins contain around 25 micrograms of B12, which may help maintain intake, but that is not the same as a treatment dose for real deficiency. The testing matters. Ask your clinician about a complete blood count, serum B12, and if results are borderline or symptoms strongly suggest deficiency. Methylmalonic acid, often shortened to MMA. Mayo Clinic lab notes that serum B12 alone does not detect all cases, and MMA is the most sensitive test for cellular B12 deficiency. Sometimes homocysteine is checked too. If pernicious anemia is suspected, an intrinsic factor blocking antibody test can help. This week, do 3 simple things. First, write down any tingling, numbness, balance changes, near falls, memory slips, mood changes, or unusual fatigue. Second, add 1B, 1,2 rich or fortified food each day, such as salmon, trout, sardines, milk, Greek yogurt, eggs, fortified cereal, fortified nutritional yeast, or fortified soy milk. Third, review your medications with your clinician, especially metformin and long-term acid reducers. Do not stop them on your own. Ask whether you still need them and whether your B12 should be monitored. You are not powerless here. A symptom that looks like decline may be a signal your body is missing something it needs. The goal is not fear. The goal is to catch the pattern early enough to protect your nerves, your balance, your clarity, and your independence. Start with the food, check the labels, track the signs, and if the warning signs are there, ask for the right tests this week.